Hello and welcome to This Explainer. If you're watching this, you've recently undergone a Paramedian forehead flap surgery with Advanced Dermatologic Surgery. First off, a huge congratulations on completing this really important first step. My goal today is to calmly and clearly walk you right through your post-operative care. We're going to break down exactly what you need to know, what you should expect, and how you can take the absolute best care of your surgical site. Let's get right into it.
Here is our agenda for today. 1. The bandage and bridge. 2. Managing normal post-op bleeding. 3. Bruising, swelling, and rest. 4. Medications and daily care. 5. 5 warning signs. And 6. Contacting the office.
Section 1. The bandage and bridge, your immediate post-op reality. Right now, you're probably looking in the mirror at this really large, bulky white bandage on your face. I know it looks like a whole lot, but I assure you, it is exactly how it should look. The reason for this bulky dressing is what's hiding underneath it, something we call the bridge. Because this is a two-stage repair, a connected section of tissue is purposely left intact between your forehead and your nose. Think of this bridge as a lifeline. It ensures that the new skin maintains a robust, healthy blood supply. Now, what's really important here is the why. Protecting this bridge is your absolute #1 job, so the tissue thrives until your next surgery in about 3 weeks. Because that bridge is so crucial, we have a golden rule. Keep that bulky white bandage in place and keep it completely dry. Just do not remove it. The office is actually going to handle all of your regular bandage changes for you. Now, if your bandage becomes totally soaked with blood within the first 24 hours, or if it accidentally falls off on its own, please don't try to fix it yourself. Call the office immediately. Otherwise, you'll simply go in for your scheduled weekly changes. Section 2. Managing normal post-op bleeding, transforming panic into process. Look, seeing blood on your face or on your bandage can be incredibly scary. It is totally human nature to panic a bit, but I want to explicitly reassure you right now. Bleeding is completely normal and entirely expected for the first 24 to 48 hours after this specific surgery. Your bandage is actually made of heavy gauze and tape specifically designed to handle this. It might get completely saturated and it might even leak. When that happens, we have a very clear process for you to follow. To help you manage this calmly, we're keeping things super simple. Step 1, grab some extra gauze, a clean paper towel, or a washcloth, and press firmly and directly over the bandage. Step 2, hold continuous pressure for a full 30 minutes, the absolute most critical part of this step. No peeking. Do not lift the towel to check on the bleeding before those 30 minutes are up because peeking breaks the clot. Step 3, if it's still bleeding after 30 minutes, just repeat the process. If it literally will not stop after a few back-to-back attempts of firm pressure, that is when you pick up the phone and call the office. Section 3. Bruising, swelling, and rest. What to expect in the mirror. Okay, let's talk about the visual changes you're going to experience over the next week. Severe swelling, bruising, color changes around the surgery site, especially near your eyes. All of this is entirely normal. If your surgery was on your head, your eyes might actually swell completely shut. I know having your eyes swell shut sounds completely terrifying, but I want to validate that and reassure you that this is an expected part of the healing process. If the surgery was on your nose, it might feel stuffy, almost like something is stuck inside it. This is all just due to swelling, and it will slowly dissipate and get back to normal within 1 to 2 weeks. So the crucial point here is placement when you're managing that swelling with ice. You can put ice around the area, like near your swollen eyes, to find some relief. But you must not put ice directly on top of the incision for the first 48 hours. You want to keep the cold strictly away from that delicate surgical bridge we talked about earlier. Managing that swelling also comes down to your resting routine. Keeping your head elevated is hands down your absolute best defense against excessive swelling and throbbing. For the first 48 hours, keep your head raised up by using a few extra pillows, or just sleep in a recliner. And this is important. Do not sleep on the side of your body where the incision is. We want to avoid any accidental pressure on the flap while you rest. Section 4. Medications and daily care, your maintenance routine. Now let's transition into the daily tasks you can control. First, go ahead and resume all your usual medications, both over-the-counter and prescription. For pain, the recommended protocol is taking 2 extra-strength Tylenol, which is acetaminophen, pronounced acetaminophen, along with 1 to 2 ibuprofen, like Advil or Motrin. You can actually take these together every 6 hours, assuming you don't have any medical conditions that say otherwise. Finally, if you are prescribed an antibiotic, take it exactly as directed, and take it with food so you don't get an upset stomach. If you happen to experience an allergic reaction, stop taking it right away and call the office. Next up, your daily restrictions. Remember, the office handles the bandage changes, but if it accidentally falls off at home and you're in a pinch, always wash your hands first. Clean the incision with mild soap and water, apply a generous amount of Vaseline, and cover it up with a clean bandage. Above all else, never remove or manipulate that bridge of skin. As for your physical activity, skip the heavy lifting, intense cardio, bending over, and definitely no blowing your nose. Light walking is totally fine, but avoid anything that makes you sweat or puts tension on the wound. And lastly, skip all your skincare, makeup, and sunscreen for now. We need this area perfectly clean and undisturbed.
Section 5. 5 warning signs. Knowing when to reach out. To make this as simple as humanly possible, there are exactly 5 signs of infection you need to watch for. It's really easy to get anxious about every little ache, but narrowing it down to these 5 specific signs gives you a clear roadmap. Usually, if these appear, it's between days 3 and 7. Let's read through these together. Number 1, a fever over 100.4 degrees Fahrenheit. Number 2, chills. Number 3, spreading redness, warmth, or swelling around the site. Number 4, thick, yellow, or green drainage. And number 5, pain that actually worsens after day 3, or pain that gets worse after it had initially been improving. If you see any of these, call the office. Also, as a quick side note, if you get strong itching combined with bright redness, you might just be allergic to the bandage tape. In that case, give the office a call for further instructions.
Section 6. Contacting the office. We're here for you. The team at Advanced Dermatologic Surgery is your partner in this healing process. You aren't doing this alone. Your second stage, or takedown surgery, is about 3 weeks away, and you'll get a whole new set of instructions then. But for now, you are fully equipped to handle this critical first phase of recovery. You know exactly what to do. To wrap up this explainer, let's look at the key takeaways. Follow your rest and medication protocols, don't touch the bridge, and remember the 3 main reasons to call us. If your bleeding won't stop after repeated 30-minute pressure holds, if your bandage becomes totally soaked or falls off, or if you spot any of those 5 warning signs of infection, you've got the knowledge now to ensure a completely successful recovery. So the only question left is, are you ready to protect that bridge and take control of your healing journey today?